This treatment plan is the recommendation of Dr. Gary Glassman. Kerr Endodontics is a medical device manufacturer and does not dispense medical advice. Clinicians should use their own judgment in treating their patients.
Right now what we're going to do is we're going to access two natural teeth, one maxillary molar and one mandibular molar. First, the maxillary molar. So the first burr that we're going to use, once again, is going to be a round burr, number 4 or number 6, really fits the bill nicely. And we're going to enter the central fossa with that burr. Until we lose resistance. We can always check to see if we enter a root canal or in the pulp chamber, which we are. At this point, we want to refine our access with a 557 cross-cut Fisher burr. Forming a triangle with the apex of that triangle towards the palatal cusp. And the broad end of that triangle, the wide end of it, towards the buccal. Making sure that you flood that pulp chamber with full-strength sodium hypochlorite. And clean out that pulp chamber as best as you can in order to increase visualization. We have the palatal canal, and we've got one of the buccal canals here, right, which is most probably the distal buccal, and then the mesial buccal underneath that mesial buccal cusp. So we're going to want to extend our access more towards that mesial buccal cusp. So I'm going to use the LA access burr, tapered diamond burr with a safe ended tip in order to achieve that in a safe manner. Making sure that we always irrigate. All right, so here we've got the palatal canal, and I may extend a little bit more towards the palate, the distal buccal canal, and the mesial buccal canal. And the MB2 canal will probably be somewhere in here. But we have a little dentinal ledge here that would be perfect for the side of the tip of my CT4 diamond-coated tip in my ultrasonic. So I'm going to take my ultrasonic and ever so gently airbrush that little dentinal triangle away, always directing my ultrasonic away from the furcation and towards the safe area towards the mesial. We employ a process called troughing, where we create a little trough along the embryological fusion line between the mesiobuccal canal and the palatal canal. And I'll even get a little more straight line access on the palatal canal here. Always cutting it on the retrieval stroke and using the tip of the side of my ultrasonic just to get a little more straight line access and to join up my line angles. Maybe even go a little more towards the mesial buccal so I can get good straight line access. We'll flood the pulp chamber. And now we can see the palatal canal, the distal buccal canal, the mesial buccal canal, and let's look for that elusive MB2 canal, which usually lies along this line here between the MB and the palatal canals. We have the distal buccal canal, we have the mesiobuccal canal, and we have the palatal canal.